Hello, everyone. Welcome to Public Health Musings. It's good to have you on. Today, I have an amazing guest with me, someone who mentors me from very far. She doesn't know she's my mentor, but we are in the same circles and I have been following her work. She's a fellow podcaster. She's a fellow public health professional, and she's just doing some big things in public health. So I'm excited to have her on the show today. And so welcome Dr. Charlotte Hughes Huntley, who currently serves as a CEO and principal consultant at DCH Huntley LLC. She holds a PhD in public health with a specialization in epidemiology, a Master of Public Health, as well as a graduate certificate in clinical administration. She's been in public health for a long time, over 20 years of successful experience as an accomplished epidemiologist, microbiologist, consultant, and podcaster. She has worked with various industries like pharmaceutical industries, providing expertise in generating global patient population estimates utilized for assessing the market potential for drug development. She transitioned into public health some years ago as a medical technologist in hospital labs, specializing again in microbiology and infectious diseases. And she hosts the Public Health Epidemiology Conversations podcast. So I'm so excited to have Dr. Huntley on the show. Please have all the ululations and join me in welcoming her to the show. So welcome, Dr. Huntley. So glad to have you here.
Thank you. This is really a treat. I'm excited to be here.
Yay! Awesome. So we are going to learn a little bit more about you. And with all my guests, I usually ask them, what's your story? You know, like, how did you end up in public health? What motivated you? So tell us how you got to where you are.
I love that question. And of course, I'm used to asking the question. So it's always nice when the mic is reversed. Like, goodness, where do I start? You know, it's interesting though, is a lot of my guests, you know, when I ask that question, they say, well, you know, I stumbled into public health, and that's really my story. You know, I was pre-med, like a lot of us, you know, starting on the medical school track. I knew I was interested in health and you know, not so much populations, but in general health. And back in those days, it was just, you go to medical school. That was the example I saw in my family. I have an older brother who's a medical doctor, and I mean, obviously that's what you do. So I started that direction, but really did not get very far before I realized it wasn't exactly what I wanted to do, but I couldn't quite figure out what was missing or what, you know, what I needed to be doing. So I also started my family early. So I got married in early 20s and started my family. And then that career thing just kind of became a blur. So I ended up with a career in medical laboratory science. And I fell in love with microbiology, really fascinated with that area. And so I worked in laboratory science and in clinical labs for many years. I even progressed as I, you know, a little bit later on, kind of fast forward with young kids. And I, at that time I was divorced. I was a single mom with young kids. And I was like, I need to do something to kind of, you know, increase the income, and I've got to take care of them, and life is moving on. So I started looking at also a better schedule, because I was working in hospital labs and it was just a very demanding schedule. I still love the work I was doing. It was a large facility and we saw so many different cases. And I mean, I worked in parasitology and, you know, tuberculosis level 3 in the lab. And I got to really do a lot of specialized microbiology work that most hospital labs, you know, just didn't have the capacity, you know, to run those types of tests. So I really enjoyed it. But the demanding hours and structure and schedule just kept me away from my kids. So I was looking for more of a regimented schedule, and that brought me to the state public health lab. And at the same time, that was my first kind of, you know, discovery of public health. I was like, well, what is this? And I had also wanted to know, well, if of course in that field, the more education you have, the higher your salary. So I was like, okay, well, what's my next step? So I started to figure out kind of what public health was. And I had a mentor at the time that said, if you want to progress in your career, you either get an MBA and you run the lab, get into the administration area, or you can, go in the direction of public health and get a master's of public health. It's more of a research type. And that was really intriguing to me. And it was the first time I started to kind of reconnect with that early feeling of health and kind of the interest of health. And so while I was working in the state public health lab, I was also pursuing my master's in public health. And the light bulb was going off constantly because I was in a position where I was applying what I was learning like immediately, and it was just really amplified. So, I love that journey. It just really escalated. I quickly found, epidemiology to be the niche and the sweet spot. And then I realized that this is really what I wanted to do all along. I just didn't know that that's what it was. So that's kind of my journey into public health.
It's an awesome segue to what I wanted to find out more about being trained as an epidemiologist. And I like that you highlighted you enjoyed being an epidemiologist. What was that passion that you found in being an epidemiologist?
I'm really glad that you asked that question, because I knew I wanted to become an epidemiologist after learning more about the public health lab. And I did have a great mentor, my bureau chief, the Bureau of Laboratories at the time. He was really helpful in opening my eyes to all the things, but I still worked in the lab. It was that I started doing a lot of the duties that were similar to epidemiology. So I was involved in a lot of surveillance. So it wasn't just diagnostic testing at that level. I worked specifically in virology and the select agents, which was the agents of bioterrorism. And so I also did testing for things like the flu and rabies. And so that involved surveillance, where you're actually tracking and tracing and following the trends over time. And that was just, it just made sense. To me, it was the logical next step from what I had been doing. So I think the most fascinating thing for me is the population aspect, like feeling that I was making a bigger impact, because all of the diseases and problems and conditions that were most interesting to me involved a lot of people, and so I felt like it was like going big. If I'm an epidemiologist, I'm helping lots of people as opposed to one at a time. So that was the big attractor for me.
Awesome. I think I felt the same way too. My undergrad was in psychology, and I was determined to be an industrial organizational psychologist. There's a lot of money in it. And then I met public health, and I was like, oh my God, this is incredible. The focus on population, focus on community. There are so many ways you can give back through your job, and you can inspire people. And I got inspired as well. So I totally feel you on that with the population. So, as you've noticed, thanks to COVID, and you said you worked with flu and other infectious diseases. So being an epidemiologist recently became really popular, right, due to COVID. So is there anything else you want to tell us about that profession? What does an epidemiologist do? And how critical is their role in the field of public health?
Oh, yeah. So I guess what I would really like to add here is that, and this is something I kind of discovered once I got to the specialized point of epidemiology. So I'm an epidemiologist. And then it just sort of like spanned out again. So even within the niche field of epidemiology, it's still broad, because as an epidemiologist, you could put a dozen of us together in a room and ask, what's a typical day? And I have an episode even about that. And it looks so differently. So you can be an epidemiologist and work in either chronic disease or infectious disease, and it can look completely different. So when you hear about the role of the epidemiologist, like in the outbreak of with COVID, for example, that's an infectious disease. And the work there is very different than a cancer epidemiologist, who's looking at a chronic condition. So just knowing that there are so many different areas within epidemiology. So as an epidemiologist, I actually left the state, I left the laboratory system, and I worked within the pharmaceutical industry. And I worked on, I specialized in chronic diseases mostly, which up until that point, everything I had done was infectious disease. So I was focused on chronic disease, and even there, it was about incidence and prevalence. So I was tasked with a group of diseases that were in the category of central nervous system diseases, and a few cancer indications I was responsible for. And I had to estimate incidence and prevalence very specifically, by age group and gender, and by different countries. There were 7 different countries primarily, and then some others. So that type of work was, large data sets, lots of, formula involved in the models. But so that looks very different than my colleagues who are, doing disease investigations of outbreaks of, salmonella down the street kind of thing. So just knowing that it's very diverse even within that field.
Yeah. And I feel like sometimes, even as we talk to our students, many of them have that challenge in understanding this, the diversity within a particular profession. And yes, it's something we are constantly advising them. But also with COVID, we found that so many of the new students who were everybody wanted to be an epidemiologist, and we're like, that's great. You can also be a behaviorist, you can also do environmental health. There's also this other profession that you can do. But I think there's also the understanding that epidemiology is very high paying. And so it tends to attract a lot of people. But I really enjoyed my epi classes and learning all the different ways.
Yeah, I definitely, even when I moved into specializing in epidemiology, a lot of that had to do with the fact that I was still looking for I looked for the most lucrative route because, I had busy kids that were involved. They wanted to be in all these activities, and all the activities they liked cost a lot of money. And we liked taking vacations and doing things. So it was really important to me that I had to have a good living. So that was definitely a part of the attraction. But the challenge of the work, I think it felt like it was more complicated. I know a lot of people don't really even like the epidemiology courses, especially biostatistics. I didn't even like it when I first took it. Right. But I like the challenge. That's something about me too. So I do like that intellectual challenge. So for me, that was another part. I felt like I was, really using my mind every day at work. And so when I was tired, my husband now is very he manual labor. So he comes home, he's tired. And he's like, I'm I'm tired too. And he'll like, what did you do? I was like, you don't understand. Like, he's in my brain all day.
That's funny. Well, awesome. So I want to touch on your podcast, and to find out more about that, the Public Health Epidemiology Conversations podcast, which is short for PHEC. Tell us why you started this podcast. What was the story there too?
It's very similar to what you were just talking about with your students. So students, and it's not just students, but broadly. So a lot of graduates who are, early career professionals, or people had a very limited view about the career opportunities in public health. So while I had a very unique story and I was kind of living my best life, I was enjoying, or I had all these light bulb moments, it wasn't that way for a lot of people. So people were reaching out to me and asking questions. And I was getting a lot of the same questions, but from different people. How did you get into this field? How did you, become an epidemiologist? I see you have that degree, but how did you actually start doing the work? So I started realizing that all the people were asking these questions. A lot more people probably had the questions. So initially, the podcast was called Public Health Epidemiology Careers Podcast. So the first 200 episodes, or give or take, probably about 207 episodes, are all about, I was on a mission to help share these career journeys. I started out with all my friends. Like all the people I graduated with, everyone that I knew that was working in public health, I was like, come be on my new podcast and just, share your journey. And then I started to network and meet more people. And I just wanted to interview them and let them tell their story, similar to the conversation we're having now. And I wanted others to hear those stories and open their mind and be to think outside the box about things that, ways that they could advance their career. And I put epidemiology in the middle because I wanted people to become more comfortable with epidemiology. It wasn't that it was all about epidemiology, but, how can you do anything in public health without epidemiology? So that was kind of my little play on the wording there. And then over the years, I changed really just recently. I just recently changed the name from careers to conversations, because I still found that people were still a little fixated on the job title. They may have started thinking a little more broadly, but they're still just thinking about the job title a little too much. So by removing careers and replacing with conversations, I felt like that just opened everything up so people can hear our conversation and pick out the pieces that resonate with them. So that was kind of my thinking on that.
I like that. I think conversation sort of removes that mystery, in epi, because most students, honestly, if you ask them, they're like, epi, oh my God, bio starts, oh, I'm done, And those are such critical topics, when we're thinking about diseases, health behaviors, outcomes, and things of that nature. So in addition to the podcast, you also offer consulting services, and this is to help offer creative problem-solving consulting solutions to organizations that are interested in addressing public health challenges. So I can imagine right now, you probably have had so many organizations, approach you, trying to figure out how to deal with COVID. So first of all, I wanted to find out, what kinds of challenges do these organizations face or would potentially face, especially against the backdrop of COVID-19. And then you'll tell me why you left your job and started a consulting business.
So great questions. I love your questions. So I actually, I'm going to kind of mix them all together because the answers will come all out. So I started the podcast and I didn't know where I was going with that, but that was like me being in my job and just loving it. And it's like in a happy place, but I was also at the point where my kids were all grown now and I was like empty nester. I had the time to kind of focus on more of what I really wanted to do. And it was less about, raising the kids, so to speak. So the podcast was like fill a void in a sense. And I was, giving back on the platform. So it grew because people wanted more. People wanted to work with me in coaching and so forth. It grew. So I started the business was sort of developed around that. And even though I did some coaching, and I created courses and I did more, helping with the career coaching aspect of things, organizations, companies were reaching out for a variety of things. So I learned how, I say this all the time, I'm always talking about thinking outside the box and being clear about what you care about and what's important to you. And you'll be amazed at what's attracted to you. So companies were asking for help. And a lot of them were within the pharmaceutical industry because there's such an important, there's a need for the data, the epidemiology. If you think about within that industry, there's so much money spent and so much time in the drug development process. So it's important to know where the patient populations are and what that looks like and the different factors that, when it comes down to the epidemiology of disease, like how are these factors affecting populations of people and the niche groups within those populations and what current trends are affecting. When we think about, I used to cover prostate cancer, for example. So, when you think about men, Black men are going to be impacted differently than white men. If you're just thinking about the United States, and then if you start looking at different countries, there's that disparity and there's different reasons. And then, so the industry was industry leaders were reaching out and asking for help around that. It may be as simple as reports to help understand more about the background of the disease, or it may be more about analysis, or maybe data visualization, things like that. So depending on what came up, I just sort of would address them as they came up. So I did not, I never put any borders. I just left it open because I felt like if they were coming to me, there was something resonating. They resonated with something about what I was doing represented. So when the pandemic happened, I got people were reaching out from everywhere, because you have to remember, I have a back when they're searching, they're seeing epidemiology, I'm coming up, virology, I'm coming up, laboratory diagnostic testing, all the things, so I started to, kind of help and serve wherever I could. And that was just a mixture and a hodgepodge of different things. So over time, some of the things that came to me, I said yes to, and I realized, oh, I really like this. And then some of it was like, oh, I don't want to do any more of this. So it was a lot of that filtering through. So I always had a solid base in terms of the career coaching, and people really started asking more about the entrepreneurship, and they wanted to know, how do I start consulting? And so I helped that. And then the consulting with the businesses and organization was just something that filled a gap, and I never had to really push for it. So when COVID happened, I throughout that time where I helped just filling in and doing so many different things, I realized that, and at the same time, there's all this stuff happening with public health in the spotlight, so to speak, the wins and then the times that we didn't do so well. So I realized that a lot of industries were really trying to understand public health, but they were struggling to really communicate with traditional public health. They weren't going to have a nice, warm, fuzzy conversation with CDC in the middle of a pandemic. It wasn't really jiving. And it wasn't just CDC, it was just an example, but, organizations are trying to understand. They're trying to figure out how they can build and help. They're for the first time starting to see public health as it touched their industry, and they're starting to try to figure out, well, what can we do with this? So there was a need, and I really still talk to my community of public health professionals that are wanting to start consulting, to like, this is the time to get out of your comfort zone and do it, because there's all these opportunities. And at the same time, I repositioned myself so that I could be more available. So when I say consulting solutions for other organizations, it's really that if there's a health-focused organization, then epidemiology is vital to what they do. It's how they communicate, how they reach their communities, how they build a better product. It's how they know how to target. If they can understand the disease that or the condition that, I'll give you a specific example. There's a company that creates testing kits for a women's health issue. And for them to understand the epidemiology around the condition that affects the women that they're looking to create this kit for is important. It helps them to, it helps put the science behind what they do. It helps them to understand how to target their market better. So when they can work with someone like me to help them better understand that, those are the kind of partnerships that I'm developing and creating. And it's because of the pandemic that we've got more people now paying attention. Before the pandemic, they may or may not have really even thought about the connection. So is that a very long-winded answer to your question?
No, it's perfect. Because there's so many moving parts. And I think something that I try to put out there is how interconnected the field of public health is, but also very complex field. And the fact that you are this public health professional with, this clinical background, but also doing public health work and consulting with organizations like, the pharmaceutical companies, it helps show the diversity of the profession. And people now know what public health means. Before it was like, what's that again? Is it sanitation, right?
Yeah. So I actually ended up leaving my company that I work for as an employee because the opportunity with my business presented itself. And it was at the point where I did really well to do both. Very productive. I had a team from early on because I didn't want to be chained to my desk. You know, if I'm working my job and then running this business and like sprouting 3 and 4 sets of arms and legs to do it all now, I had a team. So I was very smart about that. But it got to the point where I had a organization come with me as a partnership, a contract that was so good. And the opportunity for the company and for me to grow was there and present. And it was, for me to say yes to this meant that I had to close that door as an employee and really jump out and spread my wings like I always talk about doing. So it was on like the best scenario. I mean, I had nothing but love for my company. We had I'm still very much in touch with, my coworkers from before. But it was just one of those opportunities where it was just too good to pass up. I could always get another job, but I may not always be able to create that opportunity. And and it was so exciting. It was all the things that I really wanted. So I literally stepped out full time and just never looked back, like literally never looked back. And it has just been that opportunity. It's just amplified and it brought in more. So I think that I'm able to serve freely and in a much bigger way than what I was able to do while I was still working and running the business.
That's amazing. You touched on how, you encourage people to step out. This is the time, be an entrepreneur. And I just wanted to just talk a little bit about that. You did this leap of faith and because, jobs, paid jobs give us that cushion. You have health insurance, all those things, a paycheck every 2 weeks. So you do this coaching. Could you tell us more about that? And what does that entail? How does someone venture into becoming a public health entrepreneur, if you will?
Yeah. Those are the questions that I hear all the time. And I feel that right now, especially because of all the things I just described, what the pandemic has done and how it's changed the focus. And we have so many, I think anyone and everyone that goes into public health, they're compassionate. You care about other people. And sometimes these people don't even look like you, have not any connection, but you understand populations and there's something drawing you to want to serve. So it's a field of service. So if you bring people like that to a field like entrepreneurship, where there's so much opportunity, I think there's the opportunity. I mean, there's a powerful connection there, and there's such a need. And now more than ever, we need to do public health differently. So we can't, if we really want to see some things change in the way that we all envision and we really desire, then we can't keep doing things the way we've always done them. So that means that we need people who are drawn to these concepts and ideas of, these creative ideas. So maybe it's that they see something that's completely missing, or they see something that's broken or subpar and it could be improved upon. So I just encourage people who have a vision to see one or two, and because they're going to be able to impact the populations that they care about and they connect with in a much bigger way than any single one big organization will ever do. So if I am impacting enough people and helping enough people to take that step, then, collectively, we're making a bigger impact. And that's what is needed. The communities that need to be served, that are missing out, will be served. And that's what we all want. Am I
Indeed.
Preaching now?
Amen. No, I definitely agree with you. And I think that's what drew me to public health, because there's so many opportunities to not do things as usual. The communities we work with, we always have to shift how we think. despite of the fact whether the communities look like us or not, geographical region, all those differences and context, it helps us be always creative and trying to find novel ways to help address some of these health issues. So, I mean, you've talked about that entrepreneurship, but now we have all these students, all these people who are interested in public health. What advice do you have for them? How do they get into this field? What does it take to be a student of public health, or basically the profession, if you will?
Yes, I'm glad you raised that too, because I encourage students. And one of the things I love right now is that there's so many bachelor's level programs for public health. I love that. So my advice to students is to think a whole lot less about the job title. You don't have to know exactly what you want to do at this point. Okay. So what I'm going to do is twist it around a little bit. So instead of looking for the job title a certain way or in a certain field of public, you think of as, okay, air quotes, field of public health, take a job that you enjoy and then find the public health in that location. That will serve you so much better. Then, because public health is everywhere. And then when you're able to articulate that and talk about the public health implications within that organization and what you're doing to change it or to help or how you're contributing to improving health, then as you progress in your career, that's your story, that's your journey. And that's how you improve. You take and you use what you've learned. You think away from, let's remove CDC, let's remove all of the fancy, the examples that we see in movies about public health and epidemiologists. And let's look at something more ordinary and look at environmental health, look at industry, look at occupational health and safety, look at factory work, even, product lines. Think about all of the risk involved in all the public health implications in a work situation like that. We have a large Michelin tires, okay, that, big company that they're not too far from where I live. So I often, when I drive by that plant and I see the folks that work there coming and going, I think about all of the different ways that they're involved in public health in the work that they're doing, right? So don't worry so much about getting into, a role, if you want to work in the health department or you want to work for state government or federal government and you can get into a great role like that, wonderful. But don't get hung up there. Get into something that you enjoy and find public health there and then take the next step.
That's awesome advice, and I think it goes back to what you said about doing public health differently. And I wanted to piggyback on that because, sometimes we tend to be in this silo way of thinking, even for professionals. And COVID is, really challenging us right now.
Yes.
So what kind of advice do you have for all these public health professionals and everybody, health workers and just regular people? We have the vaccines, we have people asking questions, we have misinformation. How do we do public health different?
That is like the $1 million question right there. It still goes back to, I think, really conversations. I was really intentional about selecting that word. It goes back to conversations. I think that it's not just because, we have the spotlight now as public health, right? It doesn't mean that we have to have the answer for everything. We need to have conversations. We need to be able to try to understand where people are coming from. Try to understand if they're confused, that's an opportunity to teach. But before you start teaching, really try to understand the root of their confusion and just be an ear and hear. And also, don't try to be the expert in everything. I intentionally, this is a funny story, but during the pandemic, I suddenly realized that my neighbors really know what I do for a living. People that say they don't, what's epidemiology or public health? Suddenly people that I don't even talk to knew that I was an epidemiologist because they kept finding ways to strike up a conversation, to ask questions. And I decided that even after I did a few projects around the outbreak of the numbers, I purposely removed myself because that was way too draining for me. And I was being pulled in too many different directions, trying to, to be the expert to follow this. I appreciate all the epidemiologists that choose to specialize and follow the numbers and to be there. But I also appreciate those that are focusing on self-care for the burned out epidemiologists and all the other things. So, you don't have to be the expert of everything just because you're public health. That's going to help take a lot of pressure off of you right now.
No, I totally agree with you on that. I think everyone who's in public health felt the pressure that, oh my God, here is a live lab. We can all contribute. And, there was so much coming at us, and the ambiguity of COVID-19 and just how much it changed also made public health be sort of public enemy.
Yes. I made a decision to focus on, because I do have like the specialty area of clinical research administration and my background with just the diagnostic stuff and with the pharma background. So I was really interested in vaccine development. So when I was involved in, I moderated a session at APHA, that was about the vaccine development. This was, again, we're talking about the end of last year, so the end of 2020. And that was interesting to me. I was naturally interested in that. And as the vaccine began to roll out, I decided that I wanted to really learn about the older population. And I really did a lot of digging for myself. I spoke with my colleagues who were more experts in the different areas around the vaccine development and about our rollout plan and just getting questions answered early so that I could be the voice for my elderly family members. So I did take my mother, my in-laws, my aunt and uncles, my elderly members of the family under my wings. And those are the ones that I had those real personal conversations with. So they could call me whenever they wanted. They could ask me any questions they wanted about the vaccine and about COVID and about being safe. And they were the only ones that had that freedom to do so. But I just set those boundaries because that's where I chose to kind of give out and really help and serve in my family and their immediate circles. So that was kind of like, I chose my lane to stay in with that.
That's awesome. I think it's amazing when, they have sort of this in-house expertise, but you're also not beating them over their heads. Like, right. You got to do this. You have to do this. Which sometimes as health professionals, we can be a little bit pushy, but I like your advice about really, and that's what public health is about, understanding people from where they're coming from. And communities won't always be on the same page that we are. And I realized that I'm in behavioral health. So, hey, I call myself the police of behavior. People don't like being told what to do.
No, they don't.
And so you really have to listen to them, even when you're like, that does not make sense. But I think that art of listening and compassion and empathy and respect goes a long way, especially with our communities. So you got a lot of attention from COVID and your work. How else did COVID impact your work?
My goodness. I think those are the major things. That was the things that I talked about had a lot to do with, me changing the name and kind of rebranding and positioning myself to partner with more companies that were looking for, that type of connection. And it also had a lot to do with a bit more of the shift in how I even serve my community. So I really am not taking new career coaching clients anymore. I will continue to work with, I have some clients I've worked with for a long time, but I'm not actively looking to take on new career coaching clients. Instead, I'm focused on supporting some consultants. So the public health professionals that are looking to start consulting business, the entrepreneurs, I'm really all in on helping because of, like we talked a little while ago, I really believe that that's where those folks that feel that calling in that area, that's where I feel like I can pour in the most and will have the biggest impact because that's what's needed right now. So that's still a result of the pandemic, making that kind of a shift, which is scary.
Yes, change is always scary, but it's the only thing that's constant.
Yes.
And I feel like COVID really made so many of us halt in how we see life and, how we go about life. So many changes have happened, and we have people who are leaving their paid jobs anyway.
Right.
And going to find something that they're passionate about. And I think that's what entrepreneurship comes from, that thing that makes you tick and move and you want to make a difference. And
yes.
you might not always get the money at the time you want to get it.
Yes.
But there's so much more that goes into entrepreneurial work. So as we wind down, I just wanted, it's a question I ask everybody. What is your most memorable moment in your life or in your work to date? Anything you want to share?
That one is really, really tough. Oh my goodness. I could say that the moment I completed I'll say not just when I completed my doctoral degree, but really when the hooding ceremony was major for me because it represented a major pivot in my life. At that point, it was a long time to get to that place. And it felt like turning the corner into something new and different. So that was really pivotal. And it impacted me personally and professionally and my family. And so that was really, really major for me. And probably the next best thing after that was I became a grandma this year. So that's, I had no idea how that was going to feel, but oh my gosh, it's pretty cool to be a grandma. So.
Wow, that is so cool. I'm like, I don't want to say you don't look like a grandma, but I think it's amazing for you to see this second generation, right?
Yes.
Of your work. So congratulations on being
Thank
a grandma.
you.
And I definitely concur with you with the hooding. I think the PhD was my most instrumental moment as well. It's brutal.
Yeah, it is. I think, yeah, it is such a brutal, it's like a narrow path and, you can't twist or turn because you're going to get scratched, but you got to go all the way through. And then when you do, you just feel so proud of yourself and you feel so accomplished and everything makes sense. And so, yeah, that's huge.
Awesome. So I do have some students who are currently in their PhD programs focusing on different aspects of public health, and they're really going through it. What advice would you give them?
I think, when I actually spoke to a group of doctoral students, it's been a few years back now, and there were about 120 in the room, and they were at that stage where they were all like actually working on their dissertations. And they were all leaning in, like listening and taking notes. And I still say for that journey, be flexible because I remember a lot of my colleagues, even at that time, like you have these ideas about what you want to do and you really do want to change the world and you want your dissertation to be everything just to be like so perfect and all those things. But you just be flexible because the advice that I received was you need to complete this journey. And then you've got the rest of your career as doctor to do whatever research you want to do and to explore all those avenues, but keep it manageable. So be flexible because you just don't know what the committee dynamic will look like. You can just expect to not like at least one of the committee members. Just expect it so that if it's all great, then that's a bonus. But that if you just can be flexible and know that they're really not the enemy, they are really trying to bring out the best in you and help you complete that journey. If you can be flexible, with like those things in mind, you will enjoy that journey so much better, so much more.
Perfect advice, A finished PhD is the best thing.
Exactly.
Yeah, it's often that tag with sometimes the committee and deciding which topic. And Like, just look at the exit sign.
Yes, exactly. I can give you I remember my chair wanted me to add a variable into my research, and I had already decided like, this is it. And I caught myself because I was going to like argue why I don't need to add it. I thought, add the variable, because that was his specialty. And if he's suggesting it, maybe there's something there. And side noted, there was no statistically significant findings, but there was no harm in me adding that variable. So just if they make a suggestion, just, you're better off to go with it.
Right. I remember with my chair, I was like, just tell me what you want me to do and I'll do it, because I just want to graduate.
Yes.
Do you have a topic you want me to focus on?
Exactly.
Like, so yeah, I was just gang ho on graduating, and I just was like, it's a lab, so it's not going to be perfect. You create things in a lab, and then you get out with a product. Then now you can go and be fabulous once you graduate.
Exactly.
Right. Well, I've enjoyed talking to you so much, and I'm excited that you allowed me to speak with you, even on short notice. And I've been following your work, and you're doing amazing work in public health. And, I look up to you like a big sister. So it's exciting that I'm able to speak with you. And, is there anything else you want to say? The last word?
I'd just like to thank you for inviting me. I've enjoyed the conversation as well. I love what you're doing. I encourage you to keep on going. I love what you're doing. And thank you for just inviting me to be a part of it. This has been wonderful.
Awesome. I'm sure our paths will keep crossing,
Yes.
we are in similar circles, and I'm really glad that we'll continue seeing how, our synergies and what we can do. And I just want to thank everyone for listening in or for watching this podcast, and, follow and subscribe. And if they want to get in touch with you, how do they do that, Dr. Huntley?
I would recommend checking out my website. It's drchuntley.com. So it's drchhuntley.com. And you can find everything from there: consulting, coaching, podcast, all of it.
Yes. And make sure you check out her podcast, Public Health Epidemiology Conversations podcast. Amazing, amazing conversations she has on amazing guests, and everything to think about public health. So much variability. So please check out her podcast, subscribe to her podcast as well, and hit her up for entrepreneurial advice and consulting, So thank you again. And I hope to speak with you soon and follow up on the work that you're doing.
Thank you.
Thank you, everyone.